Hi, Ed Peterson here with Peterson Family Therapy. I wanted to briefly talk about what my partner Candace and I do with depression clients. Depression is one of the hardest issues that people deal with. Most Americans have experienced it at some level or another. But for us at Peterson Family Therapy, at least for me, this is how I think about it. Depression is actually a state, it's a chemical state that happens in our brains when we start thinking everything is negative. We usually start having thoughts about ourselves that are negative, like I'm not good enough, I'm not handsome enough, I'm not powerful enough, I'm not successful enough, whatever it is. And we start believing these really negative thoughts. There's a lot of shame that comes into it. And also, we can also definitely have, something wrong with our chemistry. People struggle with depression more in the winter. People have seasonal affective disorders sometimes, so that's important. And we always try to help people get in touch with the right psychiatrist or prescribing professional, and we work with a lot of those because medications can absolutely help. Now, in talk therapy, what I like to focus on is that the depression usually has some sort of a hook that goes down to something from childhood. So I want to have a thorough understanding of what the client experienced in childhood, especially if there are any attachment wounds or attachment issues like critical parents or addictive parents or addicted parents or people in the family that passed away and grief. So that's part of it. But then it's also looking at the pattern in their life of how their mood has been generally in their life. And by being very curious and kind of being like an investigative journalist, over a few sessions, we can start understanding better, like what is contributing to this depression. And then we start working toward understanding it better, sometimes doing trauma work if they really have a lot of things from their past and their childhood that were hard. And also addressing the thought disorders, like people will think I'm always going to feel this way or no one likes me or whatever it is. And also a lot of working with depression is just emotionally attuning with the clients and letting them know that they're cared for and loved, and that I have hope. As the therapist, they need to, I have hope and I have optimism. And even when it gets really bad and people maybe get suicidal, to be able to talk with them about that and let them know that it's a very painful thing to feel that way or think that way, but it's also very normal for depressed people. Of course, if it gets bad enough that they have a plan or they're a risk to themselves or another person for harm, we then would have to get them committed to a psych ward. But before that, a lot of times, even when people are very depressed and might even talk about suicide, as long as they don't have a plan, we can help them, we can work with them. And so Candace and I really do love working with depressed clients. It's hard work, but it's so valuable, and it's so such a great feeling to see people starting to maybe get a little bit more hope, get a little more sparkle in their eyes. And so for us at Peterson Family Therapy, we are absolutely depression therapists, and we're good at it. Mainly we've been doing it for both of us for 20 plus years. And I look forward to working with any client who's suffering from depression.